Can you all see my slides okay? Okay, I can never tell. I know we all have had these fun Zoom issues as we navigate. It is 4:01 Eastern, so I'm going to go ahead and get started. Welcome again to today's webinar, Whole Child Approach to Wellness, the Rales Model Evaluation, presented by Beth Marshall, Ryan Connor, Kate Connor of the Rales Center for the Integration of Health and Education. So just a real quick overview of ASHA in case you're not familiar with us. The mission of the American School Health Association is to transform all schools into places where every student learns and thrives. The American School Health Association envisions healthy students who learn and achieve in safe and healthy environments, nurtured by caring adults functioning within coordinated school and community support systems. Just a few of our membership benefits. ASHA members receive full access to our peer-reviewed Journal of School Health. You receive free continuing education credits. So for today's webinar, you could get continuing education credits, as well as those at our conference and those associated with our journal self-studies. We also offer discounts on select AAP publications, as well as a discount to the Sex Ed Network and job postings on our Career Center. And so with that, I'm going to turn it over to today's presenters.
Sorry, thanks so much, Caitlin. Just give me 1 second while I pull up slides to share. Okay, now does everyone see my slides? Excellent. All right, thank you so much for joining us today for ASHA's webinar. I'm Beth Marshall, and I'm the Wellness Faculty Lead at the Rales Center, and we are really excited to have the chance to share with you today about a partnership between the Rales Center at Johns Hopkins and KIPP Baltimore School to develop and implement a new approach to school-based health and wellness. So today with my colleagues, Kate Connor and Ryan Connor, we're going to talk about the Rales model's implementation and impact. And then we'll get an opportunity that I'm really excited about to share some reflections through some previously recorded audio from our school partner, a parent, and some of the clinical staff about how the project is changing outcomes for kids and families in Baltimore. So just real quick learning objectives. We're going to talk about school health services and school-based health centers. We're going to talk through some of the WISC components, and we're going to describe the benefits of the integrated school health models for both health and educational outcomes. So the Rales Center for the Integration of Health and Education was launched in 2014 and motivated by the fact that across the life course, health and education are closely intertwined. Some of this is probably information that most of you know by heart, but just want to give the context sort of for how the program developed. So having more education creates opportunities for better health across the life course, and at the same time, poor health undermines the building blocks for education, like attendance and attention and engagement. And as a result, a coordinated and strategically planned school health programs and services are potentially a critical part of closing the achievement gap. So with this in mind, the Rales Center's vision is to lead the development, evaluation, dissemination of new models that integrate health, educational, and developmental services for young people and their families. Dr. Connor is going to talk a little bit about traditional school health models, so I'm going to turn it over to her.
Hi, everyone. Good afternoon. I'm Kate Connor. I am a pediatrician on the faculty at Johns Hopkins, and I'm the medical director of the Rales Health Center, and I was just seeing patients here today. So I'm excited to tell you a bit about our school health programs. Again, for those of you who are directly involved in school health service work, this may be a bit of a review, but I like to make just some definitions clear here before we dive into talking about the different programs. So school health services, next slide, Beth, please. School health services are mandated services that schools must provide for students. They ensure that kids with health conditions that could impact learning can fully participate in the educational experience. And ideally, the full scope of school health services encompasses both direct health service delivery and school-wide health promotion and disease prevention activities. Next slide, please. When school health services are delivered by a nurse, there are significant positive impacts on health and educational outcomes for students. Unfortunately, more than a quarter of schools in the US don't employ a nurse at all. In Baltimore City, one nurse is generally shared between 3 schools. Each school also has a health aide who has a nursing assistant level of training, and these folks are wonderful, highly effective professionals, and their scope of practice can be somewhat limited. So as you can imagine, this makes it difficult to accomplish all of the many tasks outlined in the prior slide that are sort of responsibilities of school health services, and can create a paradigm that's really focused on more reactive acute treatment as opposed to prevention. Next, please. School-based health centers are considered enhancements of school health services, so they're not in every school. They tend to be located in low-income communities and rural areas. There are more than 2,000 in the US, and more than, now we're up to 90 in Maryland. They're essentially pediatric clinics inside schools. They can provide acute and preventive care, and in addition to somatic services, many provide mental health, vision, and/or dental services as well. Unlike school health services, participation in school-based health centers does require parental consent, similar to other ambulatory practices. Next, please. There's a large body of evidence establishing the positive impact of school-based health centers on health and educational outcomes, particularly in low-income schools and communities. And actually, the American Academy of Pediatrics, some of you may have seen, just recently reissued a policy statement about school-based health centers reviewing their effectiveness. Of note, much of the evidence that has been published has been derived from high schools, and evaluations of comprehensive elementary and middle school programs are a bit more limited. Like school health services, school-based health centers' reach and impact is limited sometimes by systemic barriers, including, in many cases, a lack of sustainable funding sources. Next slide, please. That's back to you, Beth.
Sorry about that. So one of the unique features of the Rales model is the coordinated approach to school health. So this coordinated approach is grounded in the CDC's whole school, whole child, whole community model, which I'm sure everyone here is pretty well aware of. And so while this comprehensive and multi-level approach is often advocated for schools, it can be challenging to implement. So in 2014, during our program planning process, KIPP Baltimore expressed interest in being the demonstration site for the model. So we prioritize programming in each of the areas together based on the needs of the school. So just a little bit about KIPP Baltimore. It's made up of 2 Baltimore City public charter schools, an elementary school, which is KIPP Harmony, and a middle school, which is KIPP Ujima Village Academy. And they share one building. Together, they currently serve more than 1,600 students who are enrolled from around the city by lottery. KIPP's been located in the Walbrook neighborhood, which you can see here sort of on the west side of Baltimore for the last now 3 school years. Before that, it was located in the Park Heights neighborhood, which is a little more sort of northwest Baltimore. And when we began the partnership, school leaders shared that students had particular need for additional physical and mental health services, for health education, and for other wellness supports. So in response to those needs, the Rales model includes not just physical health services, but an equal focus on wellness programs, parent and family engagement, as well as mental and behavioral health services. So to give you a sense of programs that we've implemented based on the WISC model, this figure provides a single example for each domain of the WISC model. But this is really just a fraction of what's been implemented over the course of this partnership. So the breadth of intensity of the activities offered as part of the Rales model are really reflective of the really complex health and psychosocial needs of students, staff, and families in the setting. And each of these programs are really tailored to meet the specific needs of the KIPP community and were developed in response to needs that the KIPP community identified. Caitlin will send out some additional materials after this webinar, which includes an evaluation report, which will have a lot more details on some of the programs that were implemented than we'll be able to get into today. So a unique aspect of the model is a pretty heavy focus on data collection and rigorous program evaluation. So while a lot of school health programs exist in varying levels of intensity, rigorous evaluation is not the norm. The evaluation focused first on characterizing student health at KIPP, as there are very few data about student health status across the country. And in addition, we sought to document the process of implementing the model to form future scaling and translation efforts. And finally, to assess the impact of the model on student health and educational outcomes. So through a process of implementing the program, we documented substantial health need. As you can see here, about 65% of students at KIPP had a chronic condition, 39% were overweight or obese, 36% had asthma, and all of these are higher than the national prevalence estimates. In addition, through some screening programs, we also identified high rates of students not passing vision screening, as well as some depression symptoms in 7th graders. So as you've seen, there are a lot of elements to the model that are designed to address high levels of student health need. And today we're going to focus on a few examples of programs that had a high impact based on the program evaluation. And you can see them listed here alongside of a relative indicator of their cost. So we're going to start with some of the more cost-effective programs, including physical activity and school culture and climate programs that were led by the wellness team. So I'm going to turn it over to my colleague, Ryan Connor, who is the wellness director at KIPP.
All right, thank you, Beth. As Beth mentioned, my name is Ryan Connor. I'm the Wellness Program Director here at the Health Center. I have the privilege of working really closely with the school staff on implementing wellness programs across all domains of the WISC model. Over the 6 years, as Beth mentioned, we have implemented programming across all of those domains. But a number of years ago, we identified that we wanted to put together a little more of a strategic and targeted approach to meet the specific needs of the school. And so we use the CDC School Health Index, which, as I'm sure many of you are aware, is the CDC's assessment and planning tool aligned with the WISC model. And after going through a pretty robust process involving 7 or 8 different meetings over the span of a number of different months, leveraging stakeholders from across the school, including school leadership, culture leaders, academic leaders, school cafeteria staff, mental health partners, a wide range of individuals. We identified 3 core areas of focus that the school has been really committed to ensuring we are finding opportunities to shift over the course of this partnership. And those 3 areas were the social and emotional environment, physical activity, and health education. Next slide. So to start off, social and emotional learning has been a very key priority for the school and for our program over the lifespan of the project. As many of you, I'm sure, are aware, SEL has been a priority nationally. It's been a priority within the state of Maryland. It's been a priority within the district, and KIPP has really been kind of at the forefront of some of this work. We identified early on that the school was really committed to creating a fully integrated social and emotional environment, one that was not isolated from the academic environment, but one that was really connected to the daily instruction that was taking place around the building. And as a result, we identified 4 key pillars that became the structure of our social and emotional environment. The school identified that it wanted to ensure that social and emotional environment was restorative, trauma-informed, culturally responsive, and rooted in social justice. And so over the years, we have done a number of things from creating communities of practice. We've provided professional development or supported staff in delivering professional development. We've done coaching, we've done modeling of best practices, and we've really worked very closely with the school leadership to bring about a pretty significant change in how the staff were interacting and working with their students. One of the main things that we did was identified conscious discipline as the school's primary social and emotional model. We chose conscious discipline because it was brain-based and research-backed. We wanted to ensure that any programming that we were using had that strong evidence base. And so we've worked over the last couple of years to take the model that is conscious discipline and really create it to fit the needs of our school to ensure that it aligns with those 4 pillars. Go to the next slide, please. And so one of the key impacts that we've seen is, anecdotally, we've seen a lot of changes from teachers talking about how it is that they have felt different about how the school kind of feels like a safer and more comfortable place. But we've also had a number of teacher-reported culture and climate metrics that have improved, including things like the quality of student-teacher interactions and safety and productivity of the learning environment are things that we've documented as being pretty significant changes as a result of this work. Next slide, please. Health education was another one of the key areas that we identified through the School Health Index. We have partnered with health and wellness teachers to ensure that the whole school is receiving evidence-based, evidence-informed health education. We've leveraged 2 evidence-based programs, in particular, the CATCH program for nutrition and physical activity, and the Rights, Respect, and Responsibility, 3 R's sexual and reproductive health curriculum. We have worked with teachers to receive training on that, to receive access to resources. The CATCH program in particular was particularly useful during COVID because there were so many amazing resources through there that our teachers were able to leverage to deliver really high quality instruction to our students during their virtual instruction. And then last, we've also done a number of whole school community and health campaigns. So these are when there are other health topics that come up that the school has identified as a particular need, things like hygiene or oral health. We've been able to create programming for staff to be able to deliver. We've pushed in to deliver those to ensure that a really comprehensive health education program is occurring throughout all grades of the school. Next slide. And then last but not least, physical activity was another area that the school identified as being a key area of focus. We have really engaged in 3 key areas. First was a recess redesign based on CDC recommendations and standards. After many years of the school using a nonprofit to manage their recess, the school decided that they wanted to take on some ownership of it instead. And so using the CDC's recommendations, we were able to create a pretty robust training and coordination plan for our recess monitors and our culture team to deliver that focused a lot on class management strategies for our recess monitors and game management. So learning new games and how to instruct them on those games and how to play those games with the kids became one of the key ways that we were able to increase physical activity during that time. We also have worked with our health and wellness teachers to deliver fitnessgram testing, which is a key aspect of the health and wellness classes. They try and use data as much as possible. So our ability to support that has been really impactful. And then lastly, in-class brain breaks. Using things like Go Noodle and other programs to kind of increase physical activity during the school day has really created an opportunity for students to be a little more physically active. If you go to the next slide. And one of the things that we've been able to identify is that in 1 year alone, as a result of that work, we saw 250,000 student minutes of physical activity brought into the classroom as a result of this work. And now I will pass it back over to Dr. Connor.
Thanks, Ryan. So transitioning from wellness programming alongside the kind of population-focused wellness programming that that Ryan just discussed, the Rales Health Center also takes a population health approach to our health services delivery models. So I'm going to share a little bit about health services, and then we will also share some perspectives from some of our staff and team members about lessons learned and insights working in partnership with the school towards the end of this part of the presentation. Next slide, please. So here are some images of our lovely health center located within the KIPP Baltimore co-located public charter schools in Baltimore City. Next slide, please. In response to the needs of the KIPP Baltimore community, we built a school health program that is comprehensive and really robustly staffed. Our model is built on a foundation of expanded school health services provided by 2 full-time school nurses and a medical and nursing assistant. We also provide a full-service school-based health center, which offers acute and preventive care, as well as on-site lab and prescription delivery services. The school-based health center is staffed by our full-time pediatric nurse practitioner and myself, as well as our medical assistant. We also have a family advocate who works directly with families on individual level needs assessment and resource linkage, as well as capacity building. And we work in close collaboration with our wellness team and the school. Of note, we do not specifically offer vision, dental, or mental health services under our umbrella. And this is because we already have school and community-based partners who offer these services to our students. In addition to offering this broad array of services and supports, our program is unique in its focus on deep integration with the school and the population health approach. Next slide, please. We have found that utilization of services rose dramatically after we opened as compared to a school health program that existed prior, where there was a school-based health center clinician 1 day a week, and there was a single school nurse. So this increase in capacity really highlighted some existing unmet need despite the resources that were present in the school previously. We've continued to see very high utilization of both school health services and the school-based health center, and we have a quite high return to class rate, illustrating that we're often able to treat students who would otherwise have been sent home from school to the emergency department for care. Overall, we've prevented nearly 300 emergency department visits and their associated healthcare costs in our first 4 years. Next, please. The Rales Health Center has many innovative and high impact programs. In the interest of time, I'm going to highlight just one. The prevalence of asthma at KIPP Baltimore is about 36%, more than double the statewide prevalence. And students with previously unidentified or uncontrolled asthma were often coming into the health center wheezing and frequently missing school. We applied our integrated population health approach to building programming that was responsive to this need. So first, we created and implemented an innovative asthma screening and prioritization system, published in the Journal of School Health, for those who are interested. Students identified as high risk for previously unidentified and uncontrolled asthma are then evaluated by the school nurses, and those in need of further support receive case management. If care access is an issue, they may be referred to be seen by myself or a nurse practitioner in the school-based health center. We are then able to provide medication management services, including prescription delivery to the school. And for students who have particular issues with adherence to their daily medications, we're able to provide directly observed asthma controller therapy, where students take their daily medications each day with the school nurses and learn self-management skills to improve adherence and independence. Next, please. Now I'll highlight just a few of our asthma program impacts. In terms of health outcomes, we saw an important shift in year 4 when acute asthma exacerbation visits to the school-based health center declined by 23%. And we really felt that this reflected a flip to predominant preventive services as opposed to reactive acute service utilization. For students in our DOT program, we saw a 70% decrease in unscheduled albuterol use in the first year of that DOT program. And in terms of academic outcomes, we saw a dramatic decline of about 49% in chronic absenteeism among students with asthma. And over time, we saw modest but significant growth in reading and math assessments for students enrolled in the school-based health center. Next, please. All right, Beth, would you like me to introduce the perspectives coming up?
Yeah, if you want to introduce them, and then everyone can just check and make sure when I hit the audio, it plays.
Yes, so we'll all give a thumbs up once that happens. Thank you. We had some wonderful folks who have shared their perspectives with us and just have placed the audio here. So we're hopeful that all of our tech is friendly today. So first we're going to hear from Megan Hall. She's the Chief of Staff at KIPP Baltimore, and she's going to share some of the school's perspective on our partnership.
Hi, good morning or good afternoon. So I think there were the biggest thing for KIPP that has come out of this that is unexpected, right? So we did this needs assessment initially, and we knew even before the needs assessment, right, that we had chronic absenteeism associated with lots of different kinds of health issues, including asthma. And we knew that the services that we were receiving, the nursing services that we were receiving were never enough, right? And so I think initially we expected, right, to have obviously way more adults that could help our families. But what was really unexpected was the thought partnership and the collaboration that we've been able to have with many people on the Rales team. And so Ryan spoke a lot about the social and emotional learning programs that we've implemented. His leadership in that work really allowed for our leadership teams to implement it in a way that I don't know would have been possible without that partnership. And he spoke about that a lot, so I won't spend a ton of time on that, but the elementary school, especially our K-5, has done some really deep work there, and it's really ingrained in our staff and our students in a way that a few years ago, I don't know that we would have expected that, right? And I think we are looking forward to continuing that work with our middle school and seeing how we can make improvements there. Another kind of unexpected way was we've had a lot of mental health challenges in our community, and we had a partner that was not working well, but not a ton of bandwidth or thought partnership on what could change and how we could do something different. And so our partnership with Rales really was able to connect us with our partnership with Bayview. So even though Rales doesn't manage that work, I don't think that we would have the robust program that we have had we not had that opportunity. And then finally, in this moment of COVID, early on, as I'm sure most people are aware, we had very little guidance from the powers that be, right? We had very little guidance from the district, very little guidance from the health department, very little guidance from the state for that matter, from the country. And so that left folks like me, who I am, mostly focused on the operations of our school, really struggling on how do I help support planning for all of the unknowns. And having the Rales team, so obviously Dr. Kate and Lily especially, but every single person on the team has been such a huge part in helping us to quickly fill gaps with our community and needs within our community, identifying those things, but also just the thought partnership of being able to think through how do we do screening when eventually we have over 1,000 students in our building again, right? Like thinking through things that nobody at the district is going to be able to help us do because they have a lot on their plates as well. So I think that that collaboration and thought partnership, the high quality of the staff that we get to have in our building every day in the world before this, but on our screens every day has been really powerful and has moved the needle both for our staff and our students in ways that we couldn't have expected coming in. Hi, good morning.
Sorry, I was just going to say I should have prefaced that when we originally gave this presentation for the first time, where we had these folks share their perspectives, was in the winter/spring of last year when our initial evaluation was completed. So that's why you hear a little bit of COVID perspective that's a bit different from this moment in time, though still relevant. Our students are physically back with us in school full time at this point. So now we'll move on to share parent perspective.
Good afternoon, everyone. My name is Angelique Faith, and I'm the parent of Jalen Bird, who has been a part of the Rales Clinic for the past couple of years. There is no way to put in words how much you all are appreciated and loved. Being a single mom and having a child with multiple diagnoses can be very trying. Jalen was diagnosed with diabetes at the age of 4. It wasn't until the age of 10 when I finally gotten some relief. Prior to enrolling Jalen into KIPP, I had to leave multiple jobs, work set hours, and miss a lot of time from my employers to care for him. He missed out on multiple class trips, parties, etc., because of the shortages of nurses throughout Baltimore City. He was assigned a nurse during school for 30 minutes at lunch. Anything outside of that time, I was his nurse. If he was still sick or needed any assistance with his insulin pump, I was notified because no one at the school was trained on that. I originally applied for Jalen to be at KIPP based off of it being close to my employment at that time. I figured it would be easier for me to get to him quicker if he had a pump malfunction or needed to be picked up. It wasn't until I went to orientation after being picked off the lottery that I had finally gotten the relief that I had prayed for. I literally smiled and cried tears of joy once I heard of a clinic being inside of the school. While touring the clinic, it was a jaw dropper for me. It was so welcoming and clean, and the staff made me feel so comfortable. They wanted to know about Jalen, his likes, his dislikes, how we did things, what made him comfortable. I was introduced to the 504 plan, in which I knew nothing about prior. The knowledge that every staff member had was amazing. The care that they had given Jalen was amazing. The extra mile that they had gone for Jalen. He no longer felt different. He didn't have to pack his lunch each day. He was able to attend all trips. Snacks were provided if his sugar was to drop. Daily checks during the day were given. He was in great hands, and I was completely satisfied with the weight that I had been carrying for so long. My only con is that we're facing a pandemic. We physically can't be in touch with you all. He misses you all, and it really shows. Again, thank you all, the staff at the Rales Health Clinic, the comfort, the encouragement, the knowledge, and the love that you all have extended to my family. I want to do a major hand clap for the convenience that you all are able to connect with his providers. Everything was linked. Good afternoon, everyone.
All right, and then as I said before, we're back in school. I saw him today, so we're all back and connected. But now we're going to share some staff perspectives. I just want to talk for a brief second about our staff. You heard me mention the multidisciplinary team that makes up the Rales Health Center staff, and there really is great power in that multidisciplinary group, many of whom have been with us since the start. So look forward to hearing from them.
And just an FYI, because some of us are terrible at tech, Wilnette, who will be the third speaker, her introduction is a little cut off, but she is the family advocate and she will be speaking from her perspective.
Hello, everyone. I'm Nurse Crystal Gingrich, and I'm a school nurse at the Rales Health Center. As part of school health services, Nurse Lily and I have created a list of all students with chronic health conditions at KIPP. We have divided the students up, and each of us provides outreach to our assigned students and families. In the past year, we've had to get creative with this due to KIPP being virtual since last March. Depending on each student and family's level of need and desire for contact, we may be in touch anywhere from 3 times per school year to once a week. I've had the good fortune to get to know Ms. Bates and Jalen as one of my assigned families. It's a pleasure to work with them and to help make sure that Ms. Bates feels supported in her care for Jalen's seizure disorder and diabetes. Honestly, she does such an amazing job that a lot of what she needs is recognition and the occasional cheerleading. Lately, I've been able to provide support as she navigates dealing with an almost teenager who is struggling with the challenges of having a chronic illness. Some other families require more hands-on assistance with navigating our complex healthcare system and building their health literacy. I've found that by forming a warm relationship with each family, they are more likely to open up about the areas where they need help.
Hi, I'm Lily Mendelson. I'm a school nurse and the manager of school health services. One of the great things about our model is the opportunity we have to help our patients grow and learn over the years. I will never forget how proud I felt when I watched a student who was once very embarrassed by their diabetes proudly show off their insulin pump to their friends and explain how it works. Another student with cystic fibrosis went from being a pretty passive recipient of nursing cares to teaching his science teacher how to run a G-tube feed, and then to attending a 2-week-long summertime sleepaway camp for kids with medical needs. And that was his first time sleeping outside of his own house. As that student prepares to go to high school, I'm sad he's leaving, but I'm not worried about him. His empowerment and advocacy skills are obvious as I listen to him rattle off his med list, ask really thoughtful questions about his treatment plan, and skillfully navigate my chart to message his multiple care teams. Another benefit of our program model is the integration with school, as Ms. Bates and Ms. Hall kind of touched on. Our team is often invited to IEP and Section 504 meetings, both having the goal of ensuring students at our school have all the services and supports they need to succeed. During a recent 504 meeting for a student with sickle cell disease, we discussed sickle cell and its effects on his health. And afterwards, his teachers independently made changes in the classroom to support him. They bought a small space heater for him to use in the classroom in case he got a little bit chilly, and kept a box of his favorite snacks on hand. When he reports pain in the classroom, the teachers send him straight to us so we can assess him thoroughly. And they always send a little book or coloring or something along to read, to do for distraction. With appropriate releases, we can speak directly with school staff about our patients and gain insight into their lives that we otherwise would not have access to. Educators also reach out to us with their concerns, and we're able to work as a team to ensure that the student and the family are receiving the care they need, whether that means coaching on med adherence or connection to mental health services. We're able to kind of fill those gaps as much as possible.
And
there we go.
Family advocate at the Rales Clinic. We know that children are affected by what happens in the home as well as what happens at school. At the school-based health center, we have the opportunity to impact the whole family as well as the child. As a family advocate, I coordinate with the school social workers to help in areas where they cannot always assist. I can make home visits, pick up prescriptions, and help families with navigating the healthcare systems by making appointments and referring for mental health services, both within the school and the outside community. We assist in helping with resources families may need, such as past due utility bills, temporary housing and food resources, and other items or things or resources families may need. During COVID, I have been able to pick up and deliver food to families on a regular basis. The whole child approach supports and nurtures all areas of a child's development. So when the needs at home and school are met, the students' chances for good health and successful education outcomes are greatly increased.
Thanks, Lynette. My name is Teresa Wiggins. I am the PNP in the Rales Health Center. This will be my 6th year at the KIPP school. Along with direct patient care, one of the many ways we support our patients and their families is to work with community partners. This includes supporting families and staying connected with primary care providers or their specialists on new or ongoing chronic health issues such as asthma or ADHD. We also help families get connected with new community providers they may need. And in some instances, we actually bring community providers into the school. I lead the RHC Vision program, a partnership with Adventure Vision that brings optometry providers to the school building. Over 5 years, we've provided over 300 pairs of glasses to KIPP students. There's nothing quite like Glasses Distribution Day. On many occasions, I have stood next to students as they put on glasses and realized the stickers on my wall are actually boats, or that their friend is standing across the hall and they couldn't pick them out of the lineup before. It's amazing to watch them smile ear to ear, looking at the pair they picked out and proudly tuck their glasses case in the bag and want to go back up to show their teachers and friends. When teachers say a student is struggling in class today because they lost their glasses or left them at home, we can hand the extra pair from the health center to them and change the whole day for them both. These are just a few examples of how we work with community providers to support our families at the RHC and find this work to be an integral part of our wraparound approach.
I'm Ms. Bailey. I've been the medical assistant and phlebotomist for the Rales Health Center for roughly 4.5 years. Since that time working here, I have found that the school-based health center is like a safe haven for adolescents to receive confidential and inclusive care in a non-judgmental, culturally sensitive environment. This might be because they see the health center staff each and every day, and which in turn builds trust. I've seen this firsthand when I'm drawing lab for students, particularly for STD testing. Unprompted, they open up to me and share their story, looking for hope and guidance. I provide the hugs they long for and the advice I would give my own sons and daughters, nieces, grandchildren, and nephews. In my time with the Rales Health Center, students have talked to me about sensitive topics such as questions about their changing bodies, difficulties with family dynamics, or even suicide. On one occasion, a therapist that works with the students at the school told me a student was struggling with suicidal thoughts and mentioned me as a person that they trusted as their confidant. I was flabbergasted, taken back when she shared that with me, that the fact that a student would open up to me, it touched my heart and reminded me that simple, seemingly small acts of kindness can mean so much to a student, even when I don't realize it at the time. It opened my eyes to see that I was more than a Band-Aid from fruit or an escape from classroom. Thank you.
All right, thanks so much for bearing with us, and thanks, Beth, for your mastery of the audio editing there, so that we could bring the voices of our staff. We offer, as you could get a sense from the staff perspectives, a lot of different types of programming, and we think it's hard to get a feel for it through just sort of slides and didactic explanations. So we hope that our staff's perspectives brought some depth to the conversation. I see that there are already some questions coming up in the chat, and we will get to those. I'll just say a few quick words in closing. When the Rales Center was founded, the plan was to conduct at least a 5-year robust evaluation of our outcomes. Year 5 was the first year of COVID, but we've presented some of the findings from our initial time, and we continue to evaluate our programs. The preliminary findings, sort of take homes, are that our integrated comprehensive school health model is associated with high utilization, better identification of students at health and social risk, and better control of chronic conditions. That we saw an improvement in teacher-rated culture and climate indicators throughout the building, and that health center enrollment was associated with both decreased chronic absenteeism among students with chronic conditions and modest but meaningful improvements in standardized test score growth over time. Additionally, as we've come through the last couple of years during the pandemic, we all on this call as school health and wellness professionals and folks who are interested in school health and wellness know that a light was shown on both the power of school health and the ways in which its capacity can be limited by funding and staffing limitations in particular, but other systematic issues as well. I think that we were fortunate that we had time to build and mature a relationship within the school building that allowed us to partner in a way that was really powerful with the school during this time. And we had to sort of pivot and change a lot of our work and programming in order to meet this moment and meet this need, as each of you undoubtedly is doing in your jobs and in your settings. And we just think that this is a really important time and space to highlight the critically important work of school health and wellness programs, particularly in the recovery as children come back into our school buildings and need the additional structure and support, for example, of a robust social emotional learning curriculum. So I want to thank all of our team members pictured here, including Sarah Johnson, our center director, who is not able to join us today, but extends her thanks for your interest and participation as well. We'd also like to thank the Rales Foundation, as well as our other generous sponsors. And we look forward to talking with you all and addressing some of your questions.
So I can take our first question. Thank you for the questions, Rahul. To get to the first question, it's hard to answer an exact number of hours going into this year, if I'm going to be totally honest. Our students have a combined health and physical education course that we call Health and Wellness, that they have 1 to 2 times a week for about 50 minutes, depending on the grade. And so our hope is that they are getting an even amount of health and physical education throughout that time, which is why we really like Catch, because of its coordinated approach to kind of really creating an integrated model for instruction. So I'll be honest, I don't have a concrete answer for that first part of the question as of right now, because we're also kind of unsure of what exactly the year is going to hold from a COVID perspective. For the second question, we absolutely do a fair amount with family engagement as it relates to health education, and particularly with nutrition. One of the things that we have done in the past is really learning from COVID and recognizing that a lot of our families struggled to be able to get into the building whenever there were events that were taking place. So pre-COVID, we did a number of partnerships with a local hotel where we actually brought in professional chefs and did cooking demonstrations. And we found that only a handful of parents were able to make it any time that we hosted it. But last year during COVID, we started to host virtual versions of those sessions, including with one of our music teacher, who is also an amazing chef and has a kind of catering business on the side, hosted a couple of virtual cooking demonstrations. And we're going to try and revitalize some of those this year, even though we are not virtual, so that we're able to leverage some of those lessons and best practices over the last year. We also have tried to do a number of other events where we're able to kind of share resources with families. We do a number of activities related to National Childhood Nutrition Month in March, where we send out a weekly newsletter that includes information on healthy recipes and gaining access to healthy foods. And so our approach has been, we are going to try and support families however we can in having access to the resources, information that can help them to make healthy choices at home as well.
I can add a bit to that as well. I think this area is a good illustration of the continuum from sort of universal intervention to targeted intervention for kids. As you heard from Ryan, Catch is one of the curricula that sort of anchors physical activity and nutrition education within the school. And we have a program within the school-based health center that is funded with support from the Maryland Community Health Resources Commission, that's targeted at weight management and diabetes prevention. And the way that that program works is that kids who have a BMI greater than 85th percentile are offered the opportunity to participate in the program if they're enrolled in our school-based health center. They complete a medical intake visit with myself or a nurse practitioner. We assess not only sort of medical risks and comorbidities, but we also talk with them about kind of motivators, facilitators, and barriers, and we identify self-management goals. They then also have an intake meeting with our family advocate, Ms. Dowadu, who then provides individual weekly coaching sessions with the parents and children to support their individual self-management goals. And the education that she provides is tailored to the specific child and family, and it is rooted in that Catch curriculum that they are getting in their classrooms in their health and wellness courses as well. So the idea is to really extend the language and the learning that they're hearing in the classroom into some of the care that we're providing within the school-based health center. And our families have really enjoyed and appreciated that program. Fortunately, now that we're a little bit more clear on the greater safety of outdoor activities, Ms. Wilnett has some walking groups where the kids and families are coming to do physical activity together, as well as learning about nutrition.
Thank you both. I'm going to add one more thing. Just that for those of you on the call who have worked in health education, you probably know that sometimes schools or districts place a lower priority on health education. And I think the status of health education now, in that it is offered to every kid from K through 8, is really as a result of the partnership and years of working together to sort of prioritize health education as a population health approach in the building.
I'm going to go ahead and jump in. If people still have questions, feel free to type it into the chat box for now. I just want to go ahead and make sure that if you all would take a minute or so and fill out today's evaluation about the webinar, as well as if you're wanting CEs, you will need to complete the evaluation. I would very much appreciate that. And again, just a reminder that the presentation slides, the recording of today's presentation, as well as any other resources will be sent out in an email to you all within the next day or so. But you can always feel free to reach out to me if you have any questions. Beth, could you link just in the chat there to your website? And if anyone were curious to learn more, is your contact information available on the site, or do you have a contact form?
Our contact information is available on the website, and I am dropping it in now. Sorry about that. I had to stop all of my sharing.
Oh, no, you're okay. I kind of put you on the spot.
No problem. So our contact information is available off of this site, as well as some of the products and resources. We talked a little bit about the final evaluation report, and that's also accessible here.
Great. Well, if we have no more questions, I think we can go ahead and wrap up today's presentation. I will add that ASHA still has a couple of webinars scheduled for this year. In October, early October 5th, we have one on puberty education, building the foundation for healthy sexual development. And then October 21st, we have a webinar on teen vaping put on by Truth Initiative. So you can go to our website and register for those and learn more about those. Will the recording be available? Yes, I will work on getting it posted within the next day, and it will be on our website as well as sent out via email in the next day. So with that, I want to thank you all for joining us today. Thank you, Beth, Ryan, and Kate as well. It was a great presentation. I loved hearing the different perspectives. I really appreciated having that in there and having you all join us. So thank you and have a great rest of your day.
Thank you all.
Thank you.